The medical community's response to patients using AI for health information is mixed, revealing tensions between appreciating informed patients and worrying about misinformation, efficiency concerns, and changing dynamics of the doctor-patient relationship. Understanding physicians' perspectives helps contextualize both resistance and enthusiasm for AI health tools. Many clinicians genuinely welcome patients who arrive informed and prepared with questions. An educated patient who understands their condition, has researched treatment options, and comes with specific questions can have more productive appointments. These patients are often more engaged in their care, more likely to adhere to treatments, and better able to recognize warning signs requiring follow-up. AI that helps patients prepare for appointments and understand health information can support this positive dynamic. However, physicians also worry significantly about misinformation and the time required to correct AI-generated errors. When patients arrive with incorrect understanding of their condition based on AI consultations, precious appointment time must be spent correcting these misunderstandings rather than addressing actual health needs. A 15-minute appointment can be consumed by debunking AI-suggested diagnoses or explaining why AI-recommended treatments aren't appropriate, leaving little time for actual medical care. Altered expectations represent another physician concern. Patients who've researched treatments or diagnostic approaches through AI might demand specific tests or therapies that aren't medically indicated. When clinicians explain why requested interventions aren't appropriate, patients may feel dismissed or may question their doctor's expertise if it conflicts with AI information. This creates difficult conversations and can damage trust when patients perceive their informed preferences as being ignored. Longer visits to address AI-generated information affect clinic efficiency and other patients' wait times. If many patients arrive with extensive AI-researched questions or misconceptions, this increases appointment duration across the patient panel. While individual patients benefit from thorough discussion, systemic effects include longer wait times, fewer appointments available, and physician stress from perpetually running behind schedule. This creates institutional pressure to limit patient conversation, which is counterproductive for care quality. Some physicians feel threatened by AI, worrying it undermines their expertise or that patients trust algorithms more than human judgment. This anxiety is often overstated. AI cannot replace comprehensive medical evaluation, but it reflects real concerns about professional authority and the nature of medical work. When patients challenge clinical recommendations based on AI information, it can feel like professional judgment is being second-guessed by computers, which is frustrating for physicians who spent years developing medical expertise. However, forward-thinking physicians recognize that AI health tools are here to stay, and the productive response is learning to work with rather than against this reality. Some strategies clinicians are developing include proactively asking about AI use during history-taking. Questions like, have you looked up your symptoms online or used any health apps, or what have you read about this condition, open conversation about what patients believe and what information sources they've consulted. This allows physicians to address misconceptions early rather than having them emerge unexpectedly during the encounter. Providing vetted resources helps direct patients toward reliable information rather than leaving them to navigate random AI tools and websites. When physicians recommend specific patient education materials, mobile apps, or information sources they trust, patients have starting points for self-education that are likely to be accurate and appropriately comprehensive. This doesn't prevent all use of other sources, but at least ensures patients have access to quality information. Framing AI as a tool that can support but not replace medical judgment helps set appropriate expectations. Physicians can acknowledge that AI provides useful general information while explaining limitations, inability to examine patients, lack of access to test results and medical history, inability to account for individual circumstances, and tendency to present possibilities without adequate probability context. This educational approach helps patients use AI information appropriately rather than treating it as equivalent to professional medical advice. Advocating for clinician-facing AI tools that complement rather than compete with patient care represents a constructive physician response. AI that helps doctors access clinical guidelines, check drug interactions, review relevant literature, or document encounters efficiently makes physicians more effective rather than feeling replaced. When AI supports clinical work rather than positioning itself as an alternative to doctors, physicians are more likely to embrace rather than resist the technology. Collaborative models where physicians and patients review AI-generated information together during appointments could transform potential conflicts into productive partnerships. Instead of patients arriving with conclusions from AI that physicians then need to affirm or contradict, imagine appointments where doctor and patient together evaluate AI suggestions, discuss which are appropriate and why, and use AI information as a starting point for shared decision-making. This positions AI as a tool serving the therapeutic relationship rather than a competitor to it. Time efficiency in addressing common questions is another area where physician-focused use of AI could help. If AI can generate patient-specific education materials based on diagnosis and treatment plan, or answer frequent questions that don't require physician expertise, this frees physician time for aspects of care that genuinely need human professional judgment. The key is that AI supplements rather than fragments the doctor-patient relationship. Professional medical education needs to adapt to prepare doctors for practicing in an era where patients routinely consult AI. Medical schools and residency programs should teach communication strategies for addressing AI-generated patient information, techniques for efficiently correcting misinformation, and approaches to shared decision-making when patients arrive with researched preferences. New doctors should expect informed, sometimes misinformed patients and have skills to navigate these encounters productively. The fundamental physician perspective that emerges from discussing AI with medical professionals is pragmatic concern coupled with cautious openness. Doctors want patients to be informed and engaged, but not misinformed and demanding inappropriate care. They recognize AI's potential to support patient education and care preparation, but worry about accuracy, liability, and impacts on already strained appointment time. The physicians most successfully adapting to AI-informed patients are those who acknowledge the technology's reality, actively engage with what patients have learned from AI, and work to ensure AI supplements rather than undermines the physician-patient relationship that remains central to effective healthcare.